You're listening to PetLifeRadio.com.
Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds, and grooming, to pet food, pet insurance, and dental care. This is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. Because your pet health matters. Please welcome your Pet Doctor host, veterinary media consultant, and veterinarian, Dr. Bernadine Cruz.
They itch, they bite, they scratch themselves until you think you'll go crazy. Your poor cat or dog is just miserable. Pets can have skin issues for all the reasons that you and I do, and then some. How to figure out the cause and get it under control can make you feel like a CSI agent. Dr. Wayne Rosenkrantz, a board-certified veterinary dermatologist, will help you scratch out an answer to what may be bothering your pet. I'm Dr. Bernadine Cruz, and you're listening to The Pet Doctor on Pet Life Radio. We'll be right back after this short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Does your dog have problems walking with its back legs? If so, your dog is one of 58 million dogs that suffer with problems with its rear leg. Problems such as spinal myelopathy, arthritis, and hip dysplasia. Bottoms Up Leash helps your dog walk. It's a rear support harness that has won numerous awards, such as Dog Fancy's Editor's Choice Award as Product of the Year, and it's been featured on CBS and Good Morning America. Visit the website www.seniorpetsupplies.com.
Pick up something unique at A Bone to Pick Dog Boutique. A Bone to Pick has cool hip fashions for big and small dogs that will have their tails wagging in style. Cat products too. abone-to-pick.com. Check out our eco-friendly pet products and gifts for humans too. abone-to-pick.com. Get your pet's mouth watering monthly with our Gourmet Treat of the Month Club and join A Bone to Pick's free birthday club for your puppy. abone-to-pick.com. Pick up something special for your best friend at A Bone to Pick. abone-to-pick.com. Get 10% off with coupon code PETLIFE.
School's in session on Pet Life Radio with Teacher's Pet. Learn how to communicate with your pet, train your pet, and see the world from your pet's point of view. You may even learn a few tricks yourself. Teacher's Pet, only on PetLifeRadio.com.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to The Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in, and we'll see you now.
Dr. Wayne, thank you so much for being with us. This is definitely the itchy time of year for pets across the United States. Thank you again for being with us.
Sure, I'm glad to be here.
What are some of the most common reasons for a pet to have the itchy, bitey, scratchies?
Well, particularly this time of the year, as we get into the warmer weather, we all experience seeing our beautiful plants blooming and flowers amongst us in our gardens and lots of vegetation. One of the things that we see this time of the year are pollen allergies, and that's a very, very common cause for dogs to become particularly itchy. They often will chew at their paws, rub at their face, and develop secondary infections. The other big problem we see this time of the year, of course, is our little friend, the flea, starts to become very prolific, and we often see flea numbers increase with warmer weather and also humidity changes. So we start to approach sort of the perfect environmental conditions for the flea life cycle to excel. And a lot of people become more complacent on their flea control this time of the year, and we often will have complications because people sort of let their guard down and back off flea control because they haven't seen fleas, and then when we get into the warmer months, it becomes a major issue.
When you're talking about all of a sudden, here's the fleas, I have a client that just came in yesterday. She says, I've had my pet on a veterinary-approved topical flea product. Every 30 days, have been putting it on, and I'm still seeing fleas. Where do those fleas come from?
Well, I mean, we are actually starting to see some resistant issues with fleas. Some of the more premier dermatologists and parasitologists are recognizing some resistance to fleas to a lot of the products that have been around for a while. This year, in particular, it's been kind of an interesting year for flea product production because we actually have 4 products that have actually, jumped into the market and are adding to our ability to control and eliminate fleas. There are 3 relatively new topical products that are slightly different chemical-based products than some of our existing products that are out. Those are a product referred to as Vectra 3D. There's another product, Promeris, and then the Advantage company or the Bayer company has come out with Advantage Multi. And these are topicals that are slightly different, add some different, insecticidal options for us. Probably the most impressive product that we've been working with and experiencing is a new oral product called Comfortus by Lilly. And this is an oral product that's given once a month, and it's highly effective. It's probably, I think, one of the most impressive products we've seen to date. And so this adds another sort of tool for us in our regimen in trying to control and reduce fleas. The other thing to just comment on is that, making sure that people are consistent with their application. A lot of times people put the flea products on, even our traditional products like Advantage and Frontline and Revolution, which are all very, very good products. If the owners are not putting these on a regular basis, like every 4 weeks, then we open up a window of opportunity for the fleas to proliferate and create problems.
Well, Dr. Wayne, that's very good all about fleas, but I know that pollen, you were saying, is a real problem here in Southern California, and I know throughout the United States too, that pollen allergies really are causing people difficulties. We've had all this moisture, we now have the heat, all these things are blooming, as you mentioned. How can you tell if a dog or a cat has an inhaled pollen allergy versus some other reason why they're itching and scratching?
Well, the pollen allergies or environmental allergies often will present with symptoms and patterns on the body that are slightly different as far as distribution. Flea allergy dogs tend to chew and bite and irritate themselves a lot over the lower half of the body, often what we refer to as the dorsum of the tail head and the back half of the body, like the groin and caudal thigh area. Our pollen allergy dogs tend to present more with facial involvement, lower leg, paw involvement, sometimes ear infections. So often our pattern and distribution is important. Many of the pollen allergy dogs will have seasonal history where they'll have intense symptoms certain times of the year and be fairly quiescent at other times. Some can be year-round depending upon what they're allergic to. The other important thing in pursuing environmental allergies is ruling out other differentials. So you want to make sure you eliminate other itchy skin conditions like mange mites and things of that type. We can actually perform allergy testing in dogs, and this can be done one of 2 ways. You can do intradermal skin testing, which is similar to scratch testing that's done in people, or you can also do in vitro testing, which is similar to RAST or ELISA testing. In dogs, generally, we prefer the scratch test or the intradermal test, although there are indications for the blood allergy testing as well. And in cats, actually, the blood allergy testing seems to actually be one of our sort of better ways of doing and performing tests. So that's kind of how we, at least come up with answers and support of the environmental allergies. And some of the environmental tests lead us to treatment options as well.
What would be some of the treatments that you could use for these dogs that have inhaled allergies? People say, well, it spends all the time indoors, so how can it have inhaled allergies?
A lot of times, of course, if you're a person that suffers from hay fever or asthma, you can relate a lot to patients of our dogs that have, say, allergies where there's going to be symptoms of itching and scratching and chewing, even indoor individuals, when the season is correct, can still have symptoms. It may be minimized by being inside, but the pollens do circulate even inside the house. And then you do have people and pets that are allergic to indoor items such as house dust mites, cotton, molds, things of that nature. We even have dogs and cats, for that matter, that are allergic to human dander, just like we can be allergic to cat dander. There are pets that certainly can react to the dander and scale from our skin.
So we have to get rid of the human for that particular
well, that would be, that's right. We would have to stay outside in a potential doghouse or something like that. But there are methods. See, the idea behind allergy testing in a lot of the cases that we see, we actually will try to avoid some of the things that dogs are allergic to by doing the appropriate testing. But the other way of dealing with this is something called immunotherapy, where you actually give back allergy extracts and try to create a tolerance to these environmental allergens. And most of the owners can actually do this at home, and that's one method of treatment. There are many other methods of controlling allergies, and of course, cortisone or steroids or glucocorticoids are a common drug that's used and very helpful, but we don't like to rely a lot on steroid therapy as there can be side effects. Another drug that's come to light recently is a drug called cyclosporin, or the veterinary formulation of it is Atopica. And the Atopica is an FDA-approved drug designed for allergy management in the dog, and it also has a high success rate. But both the steroids and the cyclosporin are immune-suppressive, immune-modulating agents, and so these often are indicated but have to be, administered obviously with veterinary supervision and indications. Some of the safer treatments that unfortunately are not very effective, such as antihistamines or fatty acids, can be readily employed by clients and through veterinary recommendations as well, but often only produce about 15 or 20% success rate at best.
You were talking about allergy testing, and I know many clients will come to me saying, I'm sure my dog has a food allergy, and I want to do an allergy test, a blood test, that will prove whether or not this dog has this allergy. And what are your feelings about doing blood testing for food allergies?
Well, this is a very controversial area right now, and most of the dermatologists, and myself included, feel that blood testing or even scratch testing for food allergies is plagued with lots of errors and inaccuracy. There are some studies that are currently being evaluated in Europe to suggest that some food screens might have value if the number of food reactors is very high and the intensity of reactivity on each of the foods that reacts is also very high. We're still not convinced that food testing has a lot of validity, so for the most part, when we're concerned about food allergy patients, we're doing strict elimination trials, and these are going to require a little bit more, should we say, client compliance, because doing food trials is very, very difficult, not necessarily on the pet as much as it is the owners, because we have to restrict to either a home-cooked diet trial or a commercial hydrolyzed or novel protein diet, and this has to be done very strictly and limitedly for around 8 weeks.
Clients will sometimes say that, my breeder mentioned that such and such a breed can't have soy or it can't have chicken. Are there breed predilections as to what they're reacting to, and is it typically a protein, a carbohydrate? What is usually most incriminated in these food allergies?
That's a great question. I mean, the question about specific breeds having one particular type of protein allergy has not really been well substantiated. There is experimental breeding pools of dogs that have had demonstration of ability to induce food allergy, and in certain members of this particular breeding line that have been somewhat inbred to create this food allergy sensitivity, there may be some predilection for certain protein allergies to occur. But in common practice, this is not something that's seen or has been recognized. As far as the particular agents that can create the actual food sensitivity, these are proteins of any type. And almost any meat protein or cereal grain protein is capable of creating an allergic reaction in dogs and in cats for that matter. So common proteins such as lamb, which used to be considered magical, is no longer really our best choice for an elimination diet. Proteins such as chicken, corn, wheat, soy, dairy, these are all been incriminated and associated with food sensitivities. And so when you're doing an elimination trial, just like if you were a person seeing a human allergist, you do a detailed dietary history. What proteins has that animal been on? And those now become null and void as far as what the animal can consume. And we then select new novel proteins, and whether this is based on a home-cooked trial or, again, a commercial novel protein diet, it still has to reflect back on dietary history, with avoidance very, very important.
So novel being things like the kangaroo, the duck, the venison, some of those off-the-wall types of meat sources.
Exactly. I mean, some of our favorite diets, for example, people ask, well, what's the best home-cooked diet trial you can put a dog on? Well, actually, our best success is using vegetable-based protein, something like pinto beans combined with either canned pumpkin or canned yams, as an example. But diets such as this, although very pure and very novel, are not nutritionally balanced. And some dogs will not find them palatable, and we have to be very careful about doing prolonged courses of some of these imbalanced diets. That brings us to some of the commercial foods, and there are a couple of hydrolyzed protein diets on the market. There's a food called ZD Ultra and Purina HA. These are both hydrolyzed protein diets, and they represent proteins that have been fractionated and made into smaller molecular sizes that in theory are incapable of creating an allergic reaction. And then sort of your third choice are some of the foods that you had recommended. For example, the kangaroo and oat diet made by the Iams Eukanuba company, or the Royal Canin diets that utilize things like rabbit and duck as an example. These are proteins that certainly can be used and utilized in dietary trials. But again, home cooking is considered the most accurate, followed by hydrolyzed, and then theoretically followed by the novel protein diets as our third choices.
Well, I've tried some of my own dog clients on the pinto beans and yams routine, and most of the dogs, I've been very surprised, have enjoyed it. They haven't had killer flatulence, which I expected them to have. But it's interesting because it goes in kind of orange in the front end, and most of the time it seems to kind of come out orange on the other end too. So
it is. It's interesting. You mentioned one comment too that I want the listeners to be aware of is that some of our food allergy dogs that often will bring our sort of suspicion at a much higher level for food allergy may also have gastrointestinal history. So they may be dogs that have more flatulence, or they have more frequent bowel movements, or they may even have a history of inflammatory bowel problems. And so that present, along with skin disease, would tend to push your food allergy differential higher to the top of the list.
Well, we've been talking with Dr. Rain Rosenkrantz, a board-certified veterinary dermatologist. And when we come back after the short break, we're going to ask your dog, can you hear me now? Because oftentimes dogs will have ear issues. So we'll be right back.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
Greetings, human. What planet am I on?
Welcome to Pet Planet. Here's a copy of Pet Planet Magazine, Florida's most informative and fun pet resource magazine. It features heartwarming stories and informative articles from local and national pet experts.
Excellent.
Pet Planet Magazine offers Operation Planet Rescue, helping rescued pets find new homes. And it's available at 500 locations in South and Central Florida and 24/7 on the internet at petplanetmagazine.com. If you're out and about with your pet, you may be featured in paparazzi, candid pictures of you and your pet. For up-to-date pet-friendly events, activities, and pet-related services and products, Pet Planet Magazine is your final destination.
I shall take this magazine home with me.
Back to your home planet?
No, to my condo in Boca.
Pet Planet Magazine. Check them out at www.petplanetmagazine.com or 352-394-8578. It's out of this world.
Fluff your feathers, roll out your tongue, shine your fins, snap on your leashes, and grab your human. It's the Louisville Pet Lovers Expo. 2 full days of pet-tastic fun that no pet lover should miss. Join us for shopping, the Barks and Couture Fashion Show, Dream Pet Wedding, Ultimate Pet Makeover, Pet Communicator, Rescue Me Pet Adoption, Service Dog Demonstration, and tons of fun contests. Bring your pets and join us at the Louisville Pet Lovers Expo, Saturday, September 27th and Sunday, September 28th at the Kentucky Expo Center. For more information, go to LouisvillePetExpo.com.
When you're looking to add a pet into your life, consider adopting a homeless animal from your local shelter or rescue group. Whether you want a kitten, puppy, or a more mature pet, a purebred or a one-of-a-kind mixed breed, even a rabbit or hamster, your shelter has the best selection of animals anywhere, all screened for good health and behavior. PetLifeRadio.com presents Take Me Home with your host, Susan Daffron. Join us each week as we showcase wonderful pets, tell stories, and even throw some pet education into the mix. So get ready to find out why the pet adoption option can be a great way to add a furry companion into your life. Take Me Home every week on demand, only on PetLifeRadio.com. Let's Talk Pets on PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio with Dr. Bernadine Cruz. The doctor is in and will see you now.
Well, I'm Dr. Bernadine Cruz. You're listening to The Pet Doctor on Pet Life Radio, and Dr. Wayne Rosenkrantz is going to tell us why these ear issues. It seems like dogs, especially these floppy ear dogs, Cocker Spaniels are high on my list, always seem to have ear problems we just can't clear up.
Well, there are a lot of different causes for ear disease, and when you mentioned to begin with the Cocker Spaniel, that is a breed that is very prone to ear disease, and in Cockers in particular, one of the major causes for ear problems is an underlying condition called idiopathic Cocker seborrhea. And in that breed, we often have abnormalities related to the actual epidermal turnover time or maturation process of the skin, along with glandular abnormalities of the skin and particularly the ear. And so these dogs sort of lend themselves to having a medium for bacterial and yeast overgrowth. And in the Cocker in particular, some of the more chronic Cocker ears end up developing very proliferative or even calcifying or mineralizing ear canals, so they can be very, very challenging. The bulk of ear cases that we see on referral basis are often due, again, to allergies. And since we're talking about allergies, both environmental allergies, the atopic dermatitis dogs, and dogs with food allergy can many times present with ear problems, sometimes in conjunction with other skin disease and other times purely with just ear conditions alone. Once the ears become inflamed because of, say, an underlying allergic or seborrheic condition, as we had mentioned with the Cocker, then we end up getting secondary bacterial and yeast overgrowth problems. And then this can be, in itself, a nightmare because some of the secondary infections that develop in the ear can be very, very resistant and difficult to treat. And they often will require special diagnostic testing and sometimes repetitive sedation, ear flushing, and cleaning, depending upon the severity and the depth of the infection.
If you have, you were mentioning sometimes the ear canal will become calcified, and you lift up the ear flap, and it's like first you smell the dog before you ever lift up the ear, and you look in there, and there's no ear canal. What can be done for those dogs? It's just gotten so bad so far. There's no ear canal. What can you do for those dogs?
Well, the dogs with really very severe ear canals, and they're very proliferative, as you described, and they become very stenotic or narrow, those cases sometimes need very aggressive ear treatment medically. almost all of those cases are going to need more aggressive cultures and sensitivities and repetitive anesthesia and flushing and cleaning. At our clinic, we utilize a video otoscope, which allows us many times to see things beyond just what handheld otoscopy can yield. But when you get to cases that chronic and proliferative, you're often going to have to sometimes use high-dose cortisone therapy for short periods. Some cases may benefit from the use of cyclosporin, which is the other drug we mentioned for allergies. And in worst-case scenarios, sometimes we have to consider surgical intervention, and this is something that can be difficult for clients to decide on because some of the more severe ear procedures surgically that can be performed, such as ear canal ablation, may end up leaving the dog with very little hearing, but correct the underlying problems. So it can be very, very difficult, and with severe ear conditions, of course, veterinary attention is very important. It's important for the listeners to really not necessarily try to take matters into their own hand, but seek veterinary attention, see their veterinarian, and when things aren't going well, possibly the need for a specialist to get involved.
Skin issues can be so frustrating for the veterinarian and the pet owner because, yes, oftentimes you'll never cure them. You just seem to be able to control them, and that's wonderful. And sometimes I know my clients have said, well, the ears seem better, so I stopped after treating it for a week, though you told me to treat it for 3 weeks. And I do want the listeners to realize that there's a method to our madness when we say, yes, you need to treat for a certain period of time because so oftentimes you'll kill off those easy to kill bacteria and then the tougher guys are still around and it'll just make resistance very high on the list. One of the words that you had mentioned is idiopathic. I love that word. That was my favorite word in veterinary school because idiopathic sounds like idiot because that's, I think, how most veterinarians or MDs can feel because you can do every test under the sun and never find an answer for this. So, yes.
No, it can be very, very frustrating. There's no doubt. I mean, a lot of the ear cases, on a closing comment on that, is that you often do need to do maintenance programs. So a lot of these cases, you may do very aggressive treatment initially to get things in remission and control, but then it becomes the owner's job to do routine ear flushes and irrigations using proper disinfectants and agents to keep the ears clean and minimize the resurgence of infection. So these, again, are often products that veterinarians can pick and select based on the dog's particular ear condition.
Speaking of products, people love to use hydrogen peroxide. What is your view on using this over-the-counter product for cleaning ears?
Well, hydrogen peroxide is not necessarily my favorite product for cleaning ears. I mean, it certainly has that sudsing activity that a lot of the clients like to see, that bubbling and cleansing effect, but it can be somewhat irritating when it's used full strength. And in some of these ear conditions, you do have to be careful what you put in the ear because what we see on the outer part of the ear is only maybe the tip of the iceberg. And a lot of these dogs may actually have ruptured tympanic membranes or ruptured eardrums, and putting things in like hydrogen peroxide could potentially create, some major problems and irritancy into a middle ear if you had a ruptured eardrum as an example.
Thank you very much. This is wonderful on ears. We're saying that sometimes a client will walk through the door with their dog and I can smell it before I can see the ear infection. But there's a lot of other reasons why dogs can have that kind of stinky, rancid odor to their bodies. Cats, too. What can be some of these causes, Dr. Wayne?
Well, the ears, of course, are always one of the first area we look at when we have a dog that comes in with a complaint of odor. But the other major sources of odor that can come from the dog are obviously if there's generalized skin disease, we commonly see secondary bacterial and yeast infections in the skin. And this is one of the more common causes for body odor. Again, the infections and both bacterial and yeast will often occur as a result of other primary diseases. So we mentioned things such as allergies, but primary seborrhea, hypothyroidism, any inflammatory skin disease can create a situation where bacterial and yeast can overgrow and then ultimately end up creating body odor. Another area that's important to check, and veterinarians and groomers and owners alike don't particularly like to deal with this, but there are dogs that do end up having anal gland problems or anal gland infections or impactions. Anal glands for our current domesticated pets do not really serve major function. For wild animals, they're primarily used as a scent to mark territory, territorial marking. But for our domestic dogs, these little glands sometimes become impacted and infected and really produce a very foul odor that can be emitted sometimes, sort of without the owners being aware where the odor's coming from. These areas can be evaluated, of course, by a veterinarian by doing rectal exams with gloves and checking the glands and expressing them and infusing them. And in some situations, chronic anal gland problems result in actually the anal glands needing to be removed. And since they really don't serve any major function, it's not usually a big problem to have these excised. And then the last area to check is the oral cavity. There can be odor that comes from the lip fold. Some breeds are prone to having secondary infections because of redundant tissue in and around their mouth or muzzle area, or the odor can be coming from their oral cavity because they may need a dental or for other reasons inside their oral cavity. And again, veterinary attention is required to really help, pinpoint this problem.
What a lot of people want to do when they have that stinky pet is pop it in the bathtub, give it a good bath, and, okay, let's go ahead and do this on a weekly basis. Is there a problem with giving a pet a bath too often and using various products? A lot of people want to use baby shampoo because, wow, it's mild enough to use on a human baby. Why can't I use it on my dog or cat?
Yeah, frequent shampooing is often a question and somewhat controversial in the veterinary industry because many times we'll hear veterinarians and other people anecdotally say, well, don't bathe your pet too much, that creates problems. But actually, a lot of dogs, even those that don't have necessarily skin problems, owners like to keep their pets nice and clean. I mean, I've got a pug that has minimal skin issues, and I like my little Betty to sit up here and be, very close and up front with me. And I like her clean, and I like her smelling as good as possible. So bathing her once a week with a mild moisturizing shampoo that's not going to dry her out, but keep her clean and smelling nice is something that I personally like to do. Dogs that have skin disease can benefit tremendously by frequent bathing. And so by properly selecting the shampoo geared towards what that dog's underlying problem is, you can many times minimize the disease process or reduce the amount of systemic therapy that's needed by using the right shampoo. And shampoo selections are really, especially for skin disease, up for the veterinarian that's seeing the case to decide. Is this a shampoo that, we might want to be using to control bacterial or yeast overgrowth? So there are particular agents for that. Do we have a pet that has seborrhea with excessive scaling and flaking, and we're going to use an anti-seborrheic shampoo? Or is it an allergic dog that may be very prone to a variety of medicated products, and we want to select and use just hypoallergenic agents? So frequent bathing, definitely a good idea, especially with the right product.
And choosing that product, a lot of people want to save a couple of dollars, go to their local big box pet store and get it there and talk to an associate. Is it better to get it through a pet store or get it through your veterinarian?
Well, I mean, I think that there are certainly some over-the-counter products that have, similar active agents and then sometimes relatively similar efficacy. I mean, a common example is colloidal oatmeal or oatmeal-based shampoos. These have started off in the veterinary industry initially, and now you can go to many different pet supply places and find, more than a couple dozen different oatmeal-based shampoos. They're not always the same formulation. They're not always the same grade of what's prescription, but certainly there are products out there that are going to have comparable efficacy. More of an issue is when you're dealing with infection and when you're going to be using products that are prescription strength. So, for example, prescription strength chlorhexidine as an example, usually that's going to be in 3 to 4%, and you're not going to find that over the counter, and those products are going to work better for bacterial or yeast infections. So benzoyl peroxide is another example. Different grades of benzoyl peroxide can be very irritating, and again, some of the better veterinary prescription products have less problems with irritancy, whereas the over-the-counter benzoyl peroxide products may create more irritant or contact problems.
So when in doubt, ask your veterinarian, and when you're greatly in doubt, then you can ask your board-certified veterinary dermatologist. Very quickly, we're in summer. It's great to be outside with our pets. Are there some summer skin safety tips that you have for our pets? I know we're supposed to put on our sunscreen. What do you do for your dog or cat?
Well, a lot of times it depends on your dog's quote-unquote complexion. If you have a very light-skinned animal, Particularly, we see a lot of problems with early skin cancer or solar dermatitis in dogs such as the white bull terriers or the Staffordshire terriers, white boxers, Dalmatians, whippets. These breeds that have a tendency to have lighter skin on their ventral or their belly or axillary armpit areas and like to sunbathe, they're going to be prone to developing sunburn just like a lighter complected person would be. And so knowing your dog's sort of natural pigmentation, sort of colors and characteristics is going to be very important as far as the time that they can spend in the sun. You can use sunscreens on pets, and we tend to like the water, resistant types. I don't like the occlusive types as much. So things like the bullfrog and alligator, those tend to have more complications. We use a lot more like the copper tone, sport, and water sort of resistant that rub in more readily and are more sort of not as greasy and don't build up on the skin surface.
Well, my guest today has been Dr. Wayne Rosenkrantz, and if he sounds like he knows what he's doing, that's because he's a board-certified veterinary dermatologist who also, amongst his own peers, has been awarded the Award of Excellence for his contributions in science and education by the College of Veterinary Dermatologists. So, Dr. Wayne, you can find him in California, but you can also find him in places like Hawaii and Alaska where he does consulting. I have a feeling he's also out there playing a bit, too. Dr. Wayne, thank you so much for being with us. You've given us just some great information.
Thank you very much. It was a pleasure talking with you today.
The goal of this show has been to entertain, educate, and motivate you to be the best pet owner that you can be. If you have questions about your pet, the best person to ask is your primary care veterinarian. But if you also have questions, you can contact me here at PetLifeRadio.com. Have a great day. Tune in next week for another issue of The Pet Doctor.
Pets can be a wonderful addition to your life. Because they're a member of the family, keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. On demand every week, only on PetLifeRadio.com.